Welcome everyone to today's webinar, Solving Supply Chain Challenges from Dock to Dock, How to Optimize Supply Delivery Modes. I am Mackenzie Bean with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. We will also have a series of audience polling questions during today's webinar. When we reach each poll slide, the poll question will pop up automatically on your screen. Our speakers will give a few seconds for you to select an answer from the options on your screen and click Submit. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link used to log into today's webinar to access the recording. Our presenters today are Matt Bruggeman and Mike Hopkins. Matt Bruggeman is the Director of Solutions Development for the Pre-Source Products and Services business, where he is focused on delivering insight-driven, procedure-based solutions that enable providers to drive efficiencies in patient care. Matt has a background developing and commercializing medical products and services within the U.S. and abroad, and has mainly focused on the perioperative space in his time at Cardinal Health. In his current role, Matt is working to leverage data analytics to improve providers' procedural supply chain efficiency. Prior to his work within Presource, he led several global product businesses for Cardinal Health and held roles in research and development and marketing in the orthopedic device industry. Mike Hopkins is the Vice President of Supply Chain Distribution and Logistics for the Northwestern Medicine health system based out of Chicago. Mike has 25 years of healthcare supply chain experience and specializes in logistics and process improvement. Mike joined Northwestern in 2016 and previously worked for Owens & Minor as the Director of Supply Chain Performance. Mike is a nationally recognized leader and speaker in supply chain operations, focusing on using lean tools to facilitate process improvement and standardization. He is also a leader in the use of Kanban and RFID inventory management. Now, I'll share some background on Cardinal Health. With more than 40 years of experience, Cardinal Health is a recognized leader in transforming the healthcare supply chain for hospitals and health systems nationwide. Cardinal Health provides medical supplies and services to more than 85% of U.S. hospitals. The company has been ranked by Gartner as one of the top 5 companies in supply chain excellence for 10 consecutive years. In 2018, Cardinal Health was honored to be named to Gartner's first ever Healthcare Supply Chain Masters class in recognition of continued excellence. Next, we'll discuss webinar objectives. Today's webinar will focus on 4 main objectives. First, our speakers will define supply delivery mode and then explain how to successfully implement solutions that will help drive efficiencies within the supply chain. Next, we'll touch on how data and analytics are key to provide insights and guide operational excellence. The webinar will conclude with a spotlight on Mike's facility, Northwestern Medicine. If you'd like to submit a question for our presenters, we'll be taking audience questions throughout as they relate to the material. We will also hold a Q&A session at the end of the webinar for any remaining questions. Let's get started. First, we'd love for the audience members to please answer the following polling question that appears on your screen. Are you familiar with the concept of supply mode? Please indicate yes or no. All right, so based on our polling results, it looks like about half the audience is familiar with the concept of supply mode and half isn't. Mike, as a VP of supply chain at a leading hospital system, how do you think about supply mode?
Sure. Supply mode is essentially the way that product is received. Simply put, it's about efficiency, and I don't want my teams to touch things multiple times to go to the same place over and over again.
Yeah, I'd echo that. We define supply mode as choosing the most optimal way to receive and store product. And when thinking specifically about custom packs, you're really seeing the efficiencies in that there's less product to pick and less labor required to find and move product.
That's right, Matt. Well, in some cases, you might need to take up a little more space in your layout at the point of use locations. You're getting rid of the need for your giant internal or offsite warehouses. You're receiving product in a way that's the most efficient for your staff.
So thinking about all those labor hours, not just in handling the product once it arrives, but the work that goes into ordering and procurement on the back end, I'd imagine looking at your supply mode can reveal some real opportunities to drive efficiencies.
Definitely, Matt. It's about driving waste out of the process by looking at where and how products come in and move through the hospital. It's not necessarily the most tangible way to think about waste, but if you look at folks traveling back and forth to pick and move products, if you're looking at non-optimal storage, that's all waste. In some cases, implementing supply chain improvements, like ordering the lowest unit of measure to move products straight to point of use, like we do at Cardinal Health's Value Link, might require to take up a little more space at your point of use locations. But you're able to downsize warehouse space as well as reduce the amount of expired product you have to throw away.
So to play off that, it's also good to think about how product waste ties into it from an efficiency perspective. And I'd imagine that can be a very tangible benefit. You know, if you put something in a pack and it's not used, that's waste. So you want to look at it from the standpoint of, really, is that product coming in a different way? Or I guess on the flip side, is there something outside of a pack that's always being used, which creates added cost because you're pulling the product off the shelf each time?
Exactly. When you streamline your supply mode, you're also creating fewer purchase orders to multiple other vendors. We drive as many lines as possible through Value Link, so we're optimizing efficiencies with those deliveries.
Wonderful. And Matt, can you speak briefly to some of the solutions Cardinal Health provides as a distributor?
Yeah, absolutely. We really try to approach it in terms of a collaborative effort. We feel that by aligning our resources with our customers' needs, we can help the supply chain work better. For example, with our logical unit of measure solution, you process, handle, store, and pay for only the supplies you need when you need them. By reducing non-value added time and cost, you can see operating margin improvements and cost reduction, particularly in inventory spend, by an average of 30% or more typically. Also, we use a unique combination of people, scale, and data analytics to drive incremental savings every day with freight management.
Great. So Matt, you shared how solutions to optimize supply mode can drive efficiencies in a hospital or health system. And this can be done by connecting the dots, providing transparency and opportunities for continuous improvement and reducing waste. Mike, I'd love to hear from your perspective. Where else do you see benefits within the hospital system?
Sure. Supply chain reverberates throughout your entire hospital or network. This isn't even the bias of a supply chain professional like myself. I've been seeing how a well-oiled supply chain machine will have effects felt all the way through to clinical care settings. Ensuring we have the right products in the right places and the right data to drive insight-driven solutions to optimize how and which products we're receiving means our physicians don't have to worry. When they go into procedure, the products they need will be there.
For sure. Supply chain efficiencies aren't just about FTE reduction, though sure, that can be a part of it. When we see really successful supply chain implementations at our customers, with Northwestern, of course, being a great example, you see them working better as a health system. Standardizing supply mode solutions across a system, whether it's in custom packs, logical unit of measure distribution, or product standardization, we can really reduce touch points and drive scalable savings.
I'd just like to add a quick point to that. While some organizations look at FTE reduction as a measure of success, it really adds more value to your organization to repurpose FTEs in other parts of your supply chain. This allows even more efficiencies and sustainable results.
Great. We saw on the previous slide that success in supply chain optimization can ladder up to efficiencies in the clinical care setting. Ultimately, taking a more holistic view of the entire procedural supply process can both reduce costs and enable providers to spend more time with patients. But how do you actually get to that end result?
For starters, there isn't a finite result per se. Supply chain solutions are predicated on the idea of continuous improvement. We're constantly reevaluating and looking at the data to always be working towards that optimal mode.
So I think Mike raises a key point here. There's a lot of legwork involved to even get to that optimal supply delivery mode. You know, it requires testing capabilities, finding the best solutions, and working with the right parties to develop and scale processes. It starts with establishing a proof of concept to demonstrate the viability of a new solution. And then once the solution's been piloted, refined, and is ready to scale, ultimately it's important to build out a standardized process itself. Now, you know, it's not going to be an identical process across facilities or even across 2 floors of the same facility, frankly, but it's key to have clear steps to follow. With a proof of concept and standardized process laid out, you can really begin to gain stakeholder buy-in and scale your solution.
Mike, I'd love to hear your perspective. How do you start the implementation process to really prove out the benefits of a solution?
Absolutely. Like as Matt mentioned, a proof of concept is key. This lets people get their feet wet and comfortable with change. A successful proof of concept will let you prove out to everybody, hey, here are the benefits that come when we do this more broadly. My goal when I'm trying to do a pilot is first and foremost to find the right collaborator, someone who will see the value in what you're doing because it will provide them with direct, tangible benefits.
And I'd imagine that you would also need a flexible and understanding relationship in case the pilot doesn't go as planned.
Absolutely. You need someone who's willing to work with you through the bumps in the road as things come up in a pilot that won't go as smoothly as you hope.
Yeah, and you know, proof of concept is really something we try to do from the supplier and distributor perspective. And specifically, I'm thinking about pilot programs where we try to solve a very specific customer pain point. So in addition to working in an open, trusted relationship, it's about selecting a controlled environment where you can very easily figure out what success looks like and how you get there.
So it looks like we have had an audience question come in from Mike. And the question is, what's an example of a proof of concept you've done recently and prepared to scale, and why was it successful?
Really good question. We recently underwent a redesign of the clinical space in the OR at one of our Northwestern facilities. It was a very collaborative project, working with both supply chain and clinicians. We had to set clear parameters from the start, which literally meant starting in one operating room, which of course has its own unique layout. By working through the project, we were able to demonstrate the importance of having multiple stakeholders at the table, of working together to understand clinical versus supply chain needs. And we came out of that with a viable proof of concept for an OR redesign that reduces touch points and cuts down on waste for both supply chain and for the clinicians.
That's a really good segue into our next topic, which is how to scale a pilot through a complex hospital or health system.
Yeah, it's all about process standardization. Take our OR redesign, for example. This is something we'll want to do everywhere throughout our hospitals. But everything is so different between each space. Right off the bat, we know that there's going to be a lot of similarities, but a fair amount of differences. What works in one place isn't going to work exactly the same somewhere else.
Yeah, and we see that for sure. What works in one place isn't going to work everywhere. We know that there's so much nuance when it comes to a specific facility's needs and ultimately what you need to do to optimize supply mode there. You know, space, for instance, is huge. If you're looking at an older facility or a facility that's been added onto over the years, it's going to have vastly different needs and capabilities from a newer facility.
And even within one facility, there's so much nuance. That's why I'm a big fan of process standardization. You put the tools and systems in place, and you help reduce the potential for error.
So it sounds like there's a lot that goes into a successful implementation. I'm curious, what does success look like to you, Mike?
Successful supply mode optimization hinges on getting products to their intended point of use or as close to the point of use as possible. We're dedicated to serving the clinicians, to getting their supplies where they need them. We aim to put products in places that are clinically driven. It's important because all of this ultimately supports patient care.
And I'd say that's really where the collaborative element is key. You collaborate to establish that proof of concept and put the right processes in place, and that'll increase your odds of clinical buy-in.
Exactly, Matt.
Right, I have another audience question here for you both. Is it up to the distributor to see supplies through to the OR or point of care?
Yeah, we think so. And that's really the idea behind the dock-to-dock concept, so to speak. Historically, distributors were dependent upon to deliver products to the loading dock only. And today, we find our customers take a much more holistic view of the healthcare supply chain and procedural delivery in general. And a good relationship often means bringing product all the way through to where care is actually delivered.
Perfect. With that, let's pause for a poll for our attendees. Please take a moment to answer another polling question on your screen. Do you struggle to get buy-in to implement solutions and drive change in your organization? Please indicate yes or no. So for our viewers who do struggle with solution implementation and driving change in their organizations, what advice can you offer?
Yeah, I would say in order to drive change successfully in an organization, it's important for all parties involved to be aligned on the goals and priorities from the start. That might be an obvious statement, but, as an example, supply chain might be thinking about goals from a cost savings perspective, while clinical staff's focusing on the quality of patient care. Everyone really needs to be aligned from the start in order to be able to effectively measure the ROI.
Let's take another quick question from the audience. The question is, I struggle with sharing the data in a way that convinces stakeholders that change is necessary. Do you have any advice?
Yeah, that's a great question. Communication and trust in the data are two really important pieces to the puzzle. First, building trust in the data is key, and that needs to be done upfront when getting general alignment across all parties. We've seen a lot of projects fail for this reason, so again, I'd say it underscores the importance of aligning those stakeholders. You don't want to spend time with stakeholders defending the data in the middle of a project. And then I think second, I'd say from a communication perspective, it's important to simplify the actual story you're trying to tell with the data. You need to know and make sure that really visually the data can be understood quickly.
Wonderful. Now I'll have Mike walk you through some real-life examples of supply mode optimization and best practices within his facility, Northwestern Medicine. Northwestern Medicine is the shared strategic vision of Northwestern Memorial Healthcare and Northwestern University Feinberg School of Medicine to transform the future of healthcare. The organization offers award-winning hospitals in hundreds of locations throughout the Chicagoland area with more than 4,400 aligned physicians. Northwestern Medicine was ranked number 10 in the nation by U.S. News & World Report on its list of America's best hospitals and had 12 clinical specialties nationally ranked. Northwestern was also ranked number 1 in Illinois and in the Chicago metro region. So Mike, can you give us an overview of how you streamline supply mode in the health system?
Absolutely. First of all, it's an ongoing effort. This never ends. We're constantly looking for ways to reduce costs and drive efficiencies in the supply chain. Over the past couple of years, my team has undertaken a significant effort to put systems in place that optimize how supply is received and moved throughout the hospitals. It starts with supply mode, or how supplies are brought in, and extends from receiving through the departmental storage areas and point-of-use locations. As I mentioned before, to kick off anything, we start by getting internal buy-in and forming an initial cross-functional project team with a distributor that's committed to the same success. From there, we utilize data and analytics to develop the solution and to gain buy-in more broadly throughout the system as the project progresses. As we implement solutions, we work to ensure all staff and stakeholders are engaged and informed enough to execute effectively and to really take ownership.
When you think about the work you've done to optimize your supply chain, where do you see some of the greatest successes?
Northwestern Medicine has been investing in solutions to optimize our supply chain for decades, well before I joined the team. For instance, we've had our decasing program running with Cardinal Health for over 20 years. Through this, we're saving our employees the pains of unboxing products and dealing with corrugate. That doesn't just save us time and resources in the actual moving of product, but increases employee satisfaction, which in the long run drives our system costs down. When we can work with a distributor to streamline and optimize our supply mode, it really drives efficiencies in our system. And in this case, our employees aren't unboxing product on our loading dock in the middle of the Chicago winter. That is a win-win.
That's a good point, Mike. We believe that every part of a hospital's supply chain can be put under a magnifying glass and optimized. And really, that's why we aim to collaborate and help you look at how product is received and moved within the facility. When we look at data and involve the right stakeholders, we can drive efficiencies and costs down across the entire system.
Exactly. And we've had a lot of success in investing in various steps of our supply chain. For instance, we've put a lot of work into our receiving processes. 40% of the freight we receive daily goes to the OR and procedure rooms. When we cleaned up our entire receiving process in the last couple of years, we put extra attention on our just-in-time room. From this room, we break down products to go straight to their desired procedure locations. And working with Cardinal Health helps optimize part levels and directs the right amount of product to the right procedure areas.
Thanks, Mike. Can you explain how PACs have helped create wins for your facilities?
Sure. Our procedure PAC program with Cardinal Health Resource has led to some tangible efficiencies in our procedural supply chain. At the most basic level, the bigger our PACs, the less we have going through our other channels. But it's really the strategic work that's been done to right size and optimize our PACs that allowed us to drive down costs by creating labor and storage efficiencies. Our procedure supply area at our largest facility downtown Chicago is actually quite compact, as procedure PACs have enabled us to make the best use of our storage space and actual OR shelf space. And as far as labor efficiencies go, when products are consolidated in PACs, it is much faster for our staff to pick products for a case card.
Yeah, Mike, I know Northwestern's moved towards a lot of procedure-based modules for complex cases, some of those pictured on the slide here. In these modules, single sterile supplies and OR accessories, cleanup, etc., are bundled with a procedure pack. And as a result, there's even less product moving through other channels that needs to be picked for a case.
And we're also implementing a wave picking system that makes that even easier. It's basically combining multiple orders into a batch and reducing the number of trips staff have to make when picking. We're putting clear processes in place for staff to follow as they move through the aisles to collect products.
Yeah, it's really impressive to see, and I know it takes a lot of work. It's definitely not a one-and-done process, but rather a continual effort to right-size and really optimize a procedure pack program.
Absolutely. It's an ongoing process and one that requires collaboration across stakeholders and departments. That's where the data has been valuable. If we can show that we are driving real efficiencies that ensure the right products are in the right place at the right time, that's one less thing for our clinicians to worry about, and they have more time to focus on caring for our patients.
Yeah, and I think it goes back to that idea of process standardization that you spoke about earlier. We frequently see product standardization leading to process standardization, and that has obvious benefits throughout an entire system and really the care that's provided.
I'm curious, Mike, how do you track success? What are your KPIs?
Supply chain is what everything flows through. If we're doing our job right, we are effectively and efficiently getting supplies to the right location in the hospital while reducing costs, waste, and other inefficiencies. Operational excellence is about continuous improvement, which is why we track results on a continuous basis. Over the past 2 years, we've seen close to a $2 million reduction in inventory cost. We're disposing of far less expired product because we've optimized how and how much we should be receiving and moving to different departments on a given day. We've also reduced costly overnight shipments.
Those are some great wins. Mike, how have those projects been received throughout Northwestern on the customer side?
Well, I can't stress enough the importance of involving multiple stakeholders on both the clinical side and the supply chain side. This is instrumental to driving and scaling change throughout your system. But at the end of the day, it's all about customer service. That is the delivery cycle times to our internal customers, the departments receiving product. We track our shipments, noting any issues or discrepancies, and when there are issues, we fix our processes. Finally, our ability to sustain these solutions is a fundamental measure of success. That's why staff training is a key metric on our Managing for Daily Improvement boards. We have 7 of those throughout our main campus. Staff need to be involved, prepared, and invested in the work for it to be sustainable.
Great. Well, Matt and Mike, thank you both for sharing your knowledge. What are some key takeaways that you'd like to emphasize for the viewers?
For me, a key takeaway is that anything with any sort of downstream output needs to be standardized throughout the entire health system. For any systems in your facilities providing data, requisitions, purchase orders, they all have to be comparable and standardized. If they aren't, then we're creating unnecessary variation within our own health system and making everything more complicated.
Yeah, I'd agree. And I'd also emphasize the point you made earlier about ensuring that your relationship with your distributor is truly collaborative. Your distributor should make the supply chain process as simple as possible for you. That means putting processes and capabilities in place that are clinically driven and that get products as close to the point of use as possible. Finally, you should also make sure you're getting proof of concept and the data you need to drive future improvement strategically.
Great. Well, thank you again, Mike and Matt, and thanks everyone for your attention today. Please take a moment to complete the survey we've given each of you. Your feedback is vital in helping us continually improve the value you receive from discussions such as this one. We'll be happy now to begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. The first question is from an audience member who says, in the OR, knowing all the different service lines and sensitivities, how do you recommend standardizing and handling these sensitivities when dealing with CV, ortho, spine, general surgery, for example?
Yeah, so from my perspective at Northwestern, it's really around, you're looking at it around the process piece of standardization and not necessarily around a product piece of standardization with those things. We want to make sure that we have the right products in the right place at the right time, and we want it to make it as efficient for the clinicians as possible. So really focusing our product flow around making sure that clinicians don't have to leave the room, that they're in the case the entire time. That's really where our focus lies in that situation.
Yeah, and I'd echo that. I think there's a big push that we hear in particular around product standardization, and although it might be enticing, typically, we prefer to start from a formulary perspective. Instead of focusing on specific, service lines, is there a way to look holistically at a program if you do want to tackle product standardization and look, horizontally to where are those lowest common denominators of, commodities, of disposable products, and reducing variation where it makes sense without disrupting ultimately the clinical processes after the fact.
Great. Thank you both for weighing in there. The next question is, how do you manage supply expectations from the clinical staff compared to your supply chain staff?
For me, it's about the collaboration piece, because ultimately the supply chain folks are here to serve our customers, which is, our patients, our clinicians. So it is really a lot of time is spent with our supply chain teams, getting them to the point where they really truly understand that that's the focus, that we're not here to make things necessarily as perfect for supply chain as they could be, but we really need to make them as perfect for the patient care piece that can be. So a lot of it is really just and it's not the education, it's really just getting your teams and supply chain to understand that we're really here to service the clinicians and the patients.
Wonderful. The next question is from an audience member who is asking for more information or a demo on how exactly that OR redesign works.
So the OR redesign works in its basic format is, we have a project sponsor, we have a project lead. I should say project sponsors. We have a supply chain sponsor, we have a clinical sponsor. Then we have project leads from both ends as well. And it really starts off by, doing something as basic as a value stream map. We will lay out the actual supply space in a basement or somewhere else where we can do what's called the paper doll exercise, where before we actually make any real changes to the actual workspace, we do it in a virtual world. And then people walk through it. We do kind of like a day in a life type thing where you pretend like you're doing what you need to be doing in this space. And we do that exercise to make the changes and make sure that the workflows that we're envisioning actually work in real life before they're actually put into real life.
Great, I think that's helpful for our audience to know, so thank you. The next question is, how does Cardinal Health address physician preference materials to meet order levels?
Yeah, that's a good question. Really when we think about, again, going back to my comments about formulary, it's really a partnership, with our customers, thinking about what does that total product usage look like across service lines. How are we balancing the needs of, call it physician preference items, implants, things like that, versus, the very standard everyday type items. And ultimately, figuring out what best works from a utilization perspective, and, from a data and analytics perspective, I know we talked about that a lot today. We have capabilities that can look at PAR optimization, look at tracking of inventory from a physician preference perspective, and really marrying that data up against procedure volumes. So I think, long-winded answer, but there are several ways that we think about that across our various businesses.
And, to add to that from a Northwestern perspective is there's some unique things you can do with your distributor and the relationship to really help manage items that don't even traditionally come through distribution. So, working with your, distribution partner to really open up, the ideas of, hey, there's a better way to manage things to really get down to the point where at your campuses that you can get your inventories right-sized, especially as a health system, there's a lot of benefits to that.
Wonderful. Thank you both for your thoughts there. Another audience member is asking, what is done with a product that was in the procedure box but was not opened or used?
Yeah, so we generally will, first of all, we track that information because the purpose of putting it in the procedure box is to use it. So it's carefully measured and tracked, so that is an absolute minimal amount that comes out of that. Northwestern Medicine supports a whole bunch of, missions all over the United States and the world, and if there are things that we get to the point that they get utilized in those facets. But like I said, there is a lot of effort and time that goes into ensuring that there is minimal waste that comes out of that.
That's a really good point. Where we see, Mike mentioned this earlier when we talk about right-sizing programs, there's a continual manicuring, so to speak, that works best typically when we see customers with very well-working procedure modules. And the feedback piece of that is very important. You don't want a returns area getting overloaded with product that needs to be returned to the shelves or used elsewhere because it wasn't used in the procedure it was designed to be used in. And so I think that's a really important piece of it, is closing the gap or closing the loop on the back end to really, assess what's happening and redesign, modules or kits if necessary.
And to just add, a little bit more to that is, we'll look at a procedure pack and there might be an item in there that they use 3 of in 80% of the cases, but 2 in 100% of the cases. We'll put 2 in, but then it's really important to put the third at a point that it's really easy for access for clinicians. You don't want to put it where it's necessarily down in CSP and picked and writing back and forth. You want to put it at a place that if they're going to use it, they can easily get it. They're not going out of the room to try to get extra things that they need for the case.
Great. And Mike, this next question is also for you. An audience member said, I'm curious to know how your Cardinal Value Link program has developed over time.
We utilize it a lot more than we used to. I'm a big proponent of, our distribution relationship is a partnership. And you're entering into a large, robust partnership, and when you do those types of things, you should make them as, utilize them as much as humanly possible. So for a very long time, I've worked very hard at, utilizing that channel as much as possible. I remember, first time I ever implemented low unit measure was probably in the early 2000s, and I remember sitting with our distribution rep on a fairly frequent basis with a lot of different vendors and talking them through why it was important that they needed to participate, why they needed to put more things through the program. Because the reality is, I'll never get there, but ideally I want 100% of my products coming in at the same time in the same way, because I want to make one trip to where I need to put them away, and I want it in the unit of measure that supports patient care. I don't want to buy a box of 50 when I'm only going to use 5 in a month. I want to have that right size, because as we all know, space, especially in that OR and procedure setting, is just so valuable that being able to really optimize your low unit of measure program, value link program is something that it's absolutely necessary to make that space the most efficient it can be.
Definitely. Thank you for elaborating on that. The next question is from an audience member who asks, what best practices would you recommend for supply chain teams that are approaching clinical teams about product standardization and SKU optimization?
Data is really your friend in that regard. The better, more robust data that you can bring to the table really helps start that conversation the best way it can. Because most of the time people look at things from their perspective, right? So if you approach it with a supply chain efficiency type of perspective, it may not be the best way to start it. But when you start to look at, the benefits you can provide clinically, and that data tells that story pretty well, that's the best way to start.
Yeah, I totally agree with that. I think being very transparent and open and honest up front is where we've seen the greatest success in implementing standardization efforts. I think, to Mike's point, allaying any concerns about ulterior motives and just being very upfront about the efficiencies it can provide to the organization, and gaining trust from all stakeholders in the data is really the most important part up front.
Great. The next question is the OR inventory on perpetual inventory? And if so, were there any systems that needed to be set up or thought through for that?
So we are going through that right now at Northwestern. So they previously were not, and now we're making them in a way that it is perpetual, but not on a daily basis. It's more of a monthly basis. We've been implementing WaveMark technology within our spaces, and that allows us the visibility to make them a perpetual inventory. We don't reconcile that with finance every day. We do it every month, but it still becomes, in their view, a perpetual inventory.
Perfect. And this next question is also for you, Mike. What's been the most challenging change to make in your facility, and why? What strategies did you use to overcome that challenge?
Honestly, the biggest challenge I had was when I arrived was getting my teams to think in a different way. It wasn't really the clinicians, it wasn't administration. It was literally the supply chain teams. It was them to start realizing that they're far more valuable than they understand, and that they needed to grow as a team and grow their skills to provide the value that really allows us to become the supply chain that our patients deserve.
Thank you for touching on that. We have another audience member who is asking, does the Value Link program prove to be cost-effective and beneficial in smaller facilities, say ones with less than 100 beds?
Personally, I think that fits in an optimal way there as well. When you start looking at a small facility, space is usually super important in those places. You're utilizing things in that organization that you probably can get through ValueLink. It's shared with other customers, potentially, where you can run it through the program and not have to purchase a case of 100 or whatever the lowest or the optimal unit of measure you need to purchase from the vendor is. So I would say that from my perspective, in a smaller facility, it's probably as efficient, if not more, than larger ones.
Yeah, I was going to echo that exact sentiment. I think for many of our customers that are on the smaller side, they reap a lot of benefits out of a ValueLink program that, larger facilities, frankly, they just have more resources, they have more space, they have other, benefits as to where a smaller facility, some of the benefits of implementing a program are just amplified. Storage being a really key one.
Yeah, that makes a lot of sense. Thank you. The next question is, are there similar solutions for inpatient care units and optimizing supply distribution?
100% yes. We've been focused on the, OR and procedure areas today, but everything that we have talked about today 100% applies to the, the nursing floor settings as well. They are all looked at the exact same way. They're all on the same ValueLink program for the same exact reasons as the other spaces are. We look at it the same way as far as, wanting to provide the same level of service. We want the clinicians, again, the main focus of everything we do is, to have the right product, the right place, right time, right quantity, and the least amount of effort that a clinical person needs to put in to get it.
Yeah, and I think, as we mentioned earlier, obviously, layout of different departments will vary, needs of different departments to vary, but, at the end of the day, if you're standardizing around the process, the benefits are there, just in a different form. We talk a lot about procedural packs as well. That's another area that typically when you think procedural packs, you think of the operating room procedural areas, but, nursing floors, there are also a lot of great applications for kitting and the efficiencies it can drive.
Great. Mike, this next question is for you. The audience member says, Mike, you mentioned pick-to-light to make up service packs. Does this suggest bulk ordering of SKU levels from Cardinal Health?
Can you repeat the question, please?
Yes, of course. So it says, Mike, you mentioned pick-to-light to make up service packs. Does this suggest bulk ordering of SKU levels from Cardinal Health, i.e. warehousing usage or simply within a central supply area?
So it's not bulk. Even items that we are bringing in to add in, it still runs through ValueLink, low unit of measure. We're still right-sizing our inventory to support those types of items as well.
Perfect, thank you. And this next question is, what supply chain trend are you most excited for over the next few years?
For me, it's supply chain is actually starting to get the visibility inside of organizations it deserves. That, to me, is huge. Supply chain traditionally has been looked upon as kind of like the basement dwellers, the box movers, and now some strategic larger organizations are starting to say, wow, look at the value supply chain can bring to the entire organization, not just product costs. That, to me, is super exciting because we've been looked at for a long time as, we just crack the whip over vendors and we negotiate prices, and then, we have all these other guys that move boxes around, and that's what supply chain is, and it's just not. It's not at all what it is. And, the fact that, outside industries have seen the value in supply chain for a really long time. They put a lot of investment into it. They're attracting really great talent into it. And now, slowly but surely, that same sort of thing is happening in healthcare. And to me, that's super exciting because, I've been going to conferences and talking about the value of supply chain for a long time. And it's great to see that, a lot of people are starting to see the benefits and value.
I think on the Cardinal Health side, I'm most excited about, and this relates to Mike's comments, but just some of the changing perspective of what a distributor is and the purpose that they serve within our customer base. We talked about the partnership aspect of it during today's webinar, but really I think I'm most excited about, customers partnering more closely together with us, sharing more of their needs and pain points, and allowing us really to serve as consultative partners to really, understand what solutions may work best to solve some of those problems. So I think that more forthcoming attitude is something that we're very excited about.
Absolutely. And Mike, it looks like we've had another audience question roll in for you. And the question is, have you implemented any of these processes in ambulatory surgery centers?
We have. So we have a couple of those, and our goal is, we have we have some ambulatory surgery centers. We've got 25-bed critical access hospital. We've got 150-bed hospitals. We've got the 900+ bed Northwestern Medicine downtown. And even though they're obviously drastically different, our goal is to create a standardized way of approaching all of them in a way that our goal is sort of like, we look at 85% of a process is the same everywhere, and we have a little bit of room to tweak it because you have to based on different layouts and different sizes and things like that. But, if you walk through Northwestern operations, they operate the same way regardless of where you are. And, it's all a process. I've been here for about 3.5 years, and, we're not through everything yet, and we'll never be done, right? That's the whole idea of continuous improvement. It's never done. You're always making it better. But we have a huge focus on, standardizing how we operate, and so we are operating as a supply chain team across the entire organization.
Definitely, and in that spirit of continuous improvement, I'll stick with you on this last question. Are there any updates or new solutions that you'd like to implement at Northwestern in the future that you are working towards right now?
So definitely, a lot of them actually. Like one of our big focuses right now is implementing WaveMark RFID for procedure areas in the OR, and we have seen quite honestly like amazing successes with it in the pilot areas that we've done, and it's been so good that the organization is working on how can we fast track putting it in everywhere else. So that's a huge piece. For the first few years, a lot of it was really just building the foundation, because you can't do these really great types of things if you don't have a really solid foundation behind it. I've said this before, and I'll say it again. If you put technology on a bunch of bad processes, you just have really expensive bad processes. Like if you want to get the best you can get out of all the things you do, building that foundation is the number one place you need to focus.
Wonderful. Well, that is all the time that we have left for today. I want to thank Matt Brueggemann and Mike Hopkins for such an excellent presentation, and Cardinal Health for sponsoring today's webinar. Enjoy the rest of your day, and we look forward to having you join us for future webinars.